So will the future of hospital care be in home health visits? Well, Canterbury apparently is leading the way with this new approach, but is it working well at all? Chelsea Daniels reports.
The Canterbury Clinical Network not only celebrates the best hospital admission rates in the country, but now has the award to prove it.
Well, I think the most startling statistic, and it comes as a real surprise to us even, I think, is that 30,000 people have been kept out of hospital because of the work we've been doing. That's just one example of where we've been doing this, and that's 30% lower than the national average.
These statistics show more people are being supported to stay well closer to or in their homes by receiving healthcare, freeing up those hospital waiting rooms. The team won the Prime Minister's Award for Public Sector Excellence, presented to them on Tuesday in Wellington.
I think for me it's a tremendous recognition of all of the alliance partners that have worked together over the past 7 years to really make things better for Agnes in our community, and I'd really say the alliance approach has always encourages us to look at people and the best outcomes for our people as well as the best outcomes for the systems.
The network aims to make the patient the centre of the healthcare system, making sure to provide close and affordable healthcare to everyone in Canterbury, young or old.
Well, the Canterbury Clinical Network arose from a government initiative called Better, Sooner, More Convenient, which was a way of trying to improve mainly primary health care. One of the issues in Canterbury in particular was an ageing population. We had a higher percentage of people aged over 75, and there's a lot of world research that shows if they can be treated in the community, kept in their own homes, they have better quality of life. It's much less expensive to the health system.
The alliance structure is organised around a mythical patient named Agnes, and each sector involved with the network work together to ensure Agnes is well cared for.
It's been successful because the various groupings, the doctors, the nurses, the physios, the pharmacists, and all of those people, instead of just working in their own little world, have all come together and put aside their own individual interests to aim at a person we call Agnes, our mythical patient, who's our most important person.
The project has received worldwide recognition, with health governing bodies around the globe taking notice of Canterbury's innovative approach.
We've had interest from the rest of New Zealand and from overseas. The Health Board, who have been so supportive of this and made it possible really with their support, commissioned a report from King's College in London, and that report is very supportive of what we're doing.
And it seems Canterbury is leading the way and building a framework for the national healthcare system.
The Alliance framework has been adopted for all district health boards and PHOs across New Zealand, so it's part of the primary healthcare agreement where every PHO and district health board is required to participate in an alliance agreement.
The Canterbury Clinical Network hope to continue their success with huge plans for the future.
Lots of thoughts for the future. Right now, rural is a very large focus. So one of our strategic priorities is around equitable health outcomes across Māori, Pacific, and also our rural population. So a lot of work going into really how we're supporting those populations.
Chelsea Daniels, CTV News.